Obsessive Compulsive Disorder, often referred to as OCD, is a mental health condition that involves persistent intrusive thoughts, feelings, or urges, and repetitive behaviors or mental acts, compulsions, performed to alleviate the anxiety caused by these obsessions. OCD can vary in severity, with some individuals experiencing only mild symptoms, while others may find their daily lives significantly disrupted. Obsessions are distressing thoughts that repeatedly invade the person's mind, leading to heightened levels of anxiety. These thoughts often revolve around fears of contamination harm or doubts about whether something has been done properly. In an effort to reduce the anxiety these thoughts cause, individuals with OCD engage in compulsive behaviors such as washing their hands repeatedly, checking locks, or counting things. These behaviors may provide temporary relief, but ultimately reinforce the cycle of obsession and compulsion. Compulsions in OCD are usually carried out to prevent a feared event or situation. For example, an individual who is obsessed with the idea that their home is contaminated by germs may compulsively clean surfaces, even when there is no objective need to do so. Similarly, an individual who has intrusive thoughts about harming others may repeatedly check on family members to ensure they are safe. While the compulsive actions may provide some momentary relief from anxiety, they do not address the underlying fear, and the cycle of obsessions and compulsions often becomes increasingly more difficult to control. It is important to distinguish between OCD and other types of repetitive behaviors that may seem similar but do not involve the same level of distress or interference in daily life. For example, many people have habits such as checking that the door is locked before leaving the house, but these actions do not cause significant anxiety or disrupt their ability to function. In contrast, individuals with OCD feel compelled to engage in repetitive behaviors even if they are aware that the behaviors are excessive or irrational. The distress caused by the obsessive thoughts and the compulsive behaviors they prompt is one of the key features that set OCD apart from more typical behaviors. Obsessive compulsive disorder can also be associated with a range of other disorders and symptoms. For example, individuals with OCD may experience depression, anxiety, or other mood disorders. The persistent nature of obsessions and compulsions can be exhausting and isolating, contributing to a decline in overall well-being. In some cases, people with OCD may develop avoidance behaviors where they attempt to avoid certain situations or places that trigger their obsessive thoughts. This avoidance can further limit their social interactions and affect their ability to carry out daily tasks. Treatment for OCD typically involves a combination of psychotherapy and medication, which can help individuals manage the severity of their symptoms and improve their quality of life. Cognitive behavioral therapy, CBT, is one of the most effective forms of psychotherapy for OCD. Specifically, a type of CBT known as exposure and response prevention, ERP, is considered the gold standard for treatment. In ERP, individuals are gradually exposed to situations or thoughts that trigger their obsessions while being instructed to refrain from performing their usual compulsive behaviors. This helps individuals learn that the anxiety they experience will naturally decrease over time, even without the relief provided by their compulsions. Over time, individuals with OCD learn that their fears are often exaggerated and they can gain more control over their compulsions. Another treatment option for OCD is medication, particularly selective serotonin reuptake inhibitors, SSRIs, which are a type of antidepressant. These medications have been shown to be effective in reducing the intensity of obsessive thoughts and compulsive behaviors in many individuals with OCD. However, medication alone is often not enough to fully manage the disorder, and it is usually most effective when combined with therapy. It is also important to note that medication may not work for everyone, and some individuals may need to try different medications or dosages to find what works best for them. OCD is not the only disorder that involves compulsive behaviors. There are several other related disorders that can share similar features, but each has its own unique characteristics. For example, hoarding disorder involves the excessive accumulation of items which can interfere with daily life and lead to significant distress. People with hoarding disorder often have difficulty discarding possessions, even if they have little practical value. The behavior is driven by the belief that these items are essential or have sentimental value, leading to extreme clutter and difficulty in maintaining a clean and organized living space. Body dysmorphic disorder, BDD, is another related condition that shares some features with OCD. People with BDD are preoccupied with perceived flaws or defects in their appearance, which may be minor or not noticeable to others. This preoccupation often leads to repetitive behaviors, such as checking mirrors, grooming, or seeking reassurance from others. The distress caused by these thoughts can significantly interfere with daily life, and individuals with BDD may avoid social situations or undergo multiple cosmetic procedures in an attempt to fix their perceived flaws. Trichotillomania, also known as hair pulling disorder, is another related condition that involves repetitive behaviors. People with trichotillomania feel an irresistible urge to pull out their hair, often from the scalp, eyebrows, or eyelashes. This behavior can cause noticeable hair loss and lead to emotional distress, especially when the individual is unable to control the urge to pull. Similar to OCD, individuals with trichotillomania may try to resist the behavior but feel powerless to stop it. Like other compulsive behaviors, trichotillomania can be reinforced by temporary relief from anxiety or tension when the individual pulls out their hair. Excoriation disorder or skin picking disorder is another condition related to compulsive behaviors. Individuals with excoriation disorder have an irresistible urge to pick at their skin, often causing visible wounds or scarring. This behavior is typically triggered by anxiety or stress and can result in physical damage to the skin, leading to infections or long-term scarring. People with excoriation disorder may attempt to stop the behavior but feel unable to do so, often leading to a cycle of shame and self-blame. Treatment for this disorder often involves cognitive behavioral therapy, particularly habit reversal training, which helps individuals identify triggers for the behavior and replace it with healthier coping mechanisms. The impact of obsessive compulsive and related disorders can be profound, affecting an individual's ability to function in daily life, maintain relationships, and pursue meaningful activities. It is essential for mental health practitioners to take a compassionate and holistic approach when working with individuals who have these disorders. Treatment plans should be individualized, taking into account the person's specific symptoms, needs, and goals. Support from family, friends, and support groups can also play an important role in the healing process. With the right treatment and ongoing support, many individuals with obsessive compulsive and related disorders can learn to manage their symptoms and lead fulfilling lives.